Wrinkles, nobody wants them, but everybody gets them eventually, right? Fortunately, there are dozens of new procedures on the market that will help keep those fine lines at bay. Here with what's trending in non-surgical procedures is Dr. Patrick Flaherty. I'm so happy to welcome you back to the show.
Good to be here again.
We were just chatting. This is your first time in our new studio.
Yeah,
what do you think?
It's absolutely beautiful.
Doesn't
it's
it look
fantastic.
amazing?
Yes.
We're really excited about it.
Yeah.
Well, we're talking fine lines and wrinkles and how to get rid of them, more importantly. And these days there are so many things trending and so many options when it comes to non-surgical treatments, which I think it seems to be what everybody's looking for these days.
It is, and the biggest growth in the whole cosmetic industry has been in non-surgical procedures because new techniques, new technologies, new products allow us to do much more in the office nowadays.
And more specifically speaking, when you say non-surgical, we're really talking Botox and fillers, right?
Botox and fillers, what we call the liquid facelift, is a very popular treatment today because through injections, you know, Botox works by weakening muscles, so we can take away the frown lines and the horizontal lines in the forehead or the crow's feet. And then fillers have been a huge boom because now not only can we fill in lines and creases around the mouth, but we can lift the cheeks, fill in the temples, take away dark circles, strengthen the jawline, and even not only remove wrinkles around the mouth, but enhance the appearance of the mouth with some augmentation of the lips and other areas. So
really the goal of both is to rejuvenate the face, but they both work a little bit differently. We're looking at before and after here. What did this woman have done?
So this woman had volumizing to the face. She had a product called Sculptra, which is a biostimulator, which builds your own collagen, so you can see how much more full the face looks in the after picture. This is done through a series of treatments, but it very naturally replenishes the volume. This patient also has had volume. A big part of the aging change is loss of volume, and so there's a lot of ways to replace it. We can do that with injectable fillers. We can do it with Sculptra, which is a biostimulator. We can even do it with fat augmentation at surgery. But when you recreate some of that youthful volume, it really gives patients a much more full, youthful, and healthy appearance.
Yeah, you can tell an incredible difference there.
Yeah.
And another one of
So this is a Botox patient, and Botox creates these frown lines. This is the most common area we treat between the eyebrows. That frown line really doesn't help us much, makes us look stern or angry, unless you're trying to control your kids. That can be helpful. But afterwards, it just goes away. It makes us look much more pleasing and pleasant and relaxed and much more approachable, too, which is a really nice thing.
Such a softer look in that after photo there.
Exactly. It softens your appearance quite a bit. Really
so
nice.
what age typically do you start to see people come in wanting to learn more about these Botox and fillers? When does that start?
Well, you know, Botox you can start as early as the 30s. I mean, it just depends on how, you know, your genetics and how your facial anatomy is.
I even had friends doing it in their late 20s, so.
Yeah, so you start to see some lines and creases really in the 30s, certainly into the 40s. Those are good ages for Botox. And then fillers really at that point too, because we start to lose volume. So simple things like filling in dark circles or lifting the cheek a little bit just to restore a little bit of that lost volume or enhance the lips. And then from there it goes on. As we age, then, you know, we can apply more fillers to replace this lost volume and reshape the face.
And we mentioned non-surgical treatment. So is this something that you can get done pretty quick, or what is the downtime like?
Yeah, it's done right in the office. We use topical numbing cream to help, and the new needles are very small, so it's very doable. There's, you know, minimal discomfort. They are injections, so there always is some risk of redness and swelling and even potentially bruising. So we do ask patients to kind of take it easy that day, maybe use a little ice after the treatment, but they can use makeup the next morning. So it really is a no downtime procedure.
With that last photo where we were looking at the lines in between her eyes there and that soft look that it gave her, how many treatments did that take?
One. That's just one.
Okay.
Yeah, with Botox, those will go away in a couple of days after an injection of Botox. And the fillers, you see those results immediately too. So.
Now, if you'd like to take advantage of any of these services that Dr. Flaherty spoke about, you have different locations, a couple of locations, so you make it real convenient for everyone.
Yeah, we're in Naples, Bonita Springs, and Fort Myers, so we have convenient offices in all three locations.
What do you suggest they do if they want to get started? Is it best to come in, talk to you face-to-face, have a consultation? Should they check out your website first?
Yeah, I mean, you can get information on the website, which is azulbeauty.com, which is great. A consultation is the most meaningful because then I can really examine your face and then determine what's appropriate. And with that, we'll give them a list of all the things we think can be helpful and prices on each, and then they can choose what's right for them.
Okay. Yeah. We look forward to having you back. Thanks for taking time to chat with us today.
Nice to be here.
If you want more on Azul Cosmetic Surgery and Medical Spa, we're going to have this interview posted online. Check us out, Dr. Flaherty. We'll see you there at fox4morningblend.com.